All right. PC3 discussion number 3. So we're Medic 12 and Engine 2. We arrive on scene of a 42-year-old male who's fallen off of a ladder, or at least we assume he's fallen off of a ladder. He's unconscious, and we're beginning patient care. So the first question it wants us to discuss is what are some possibilities that would account for the situation. The first thing I noticed is it says it's a hot summer day. It's hot outside, so possibly heat exhaustion, heat stroke. He may have been up there all day. We don't really know at this point. He's been up on a ladder. We know that if you lock your legs for a long time, you can pass out. So he may have been just had his legs locked on that ladder and may have passed out because of some kind of circulation issue. We see that he's wearing flip-flops or sandals. Sandals, I guess is what it says, which isn't the best kind of footwear for being up on a ladder, so he may have just slipped. It says that, okay, and one of the first things I noticed was that it says a flower bed. He fell into a flower bed. So my first thought was bee sting, possibly, that he may have been stung by a bee, had some kind of allergic reaction, and fell. What should the paramedic be looking for during the initial assessment and focused physical exam? So obviously you're going to look for head injuries, neck injuries, any kind of trauma, any kind of crepitus, anything in the arms, legs, wrists, feet, depending upon how he fell, how he braced himself, if he was able to brace himself or if he just passed out. We don't really know at this point because the wife just heard the noise. So you're going to be looking for any kind of trauma from the fall. Possible signs of dehydration, heat exhaustion, heat stroke. We're going to be looking for feeling body temperature, see how hot he feels, different stuff like that, and just any other causes for syncope. Obviously, you're going to be looking for sting marks, anything that's out of the usual as you do the focused physical exam is going to be on the trauma and whatnot, and then the secondary will probably focus more on trying to find something hidden that we didn't notice at the beginning. And then obviously your ABCs, making sure the airway's clear, making sure that they're breathing, making sure that they're having adequate circulation and perfusion. So what information should the second paramedic attempt to obtain from the patient's wife? Obviously past medical history. Does he have any kind of cardiac, anything that would cause him to possibly just because of hypovolemia or something like that, maybe possibly because of dehydration? Does he already have cardiac issues? Does he have any kind of what did he last eat? Do we know he's been drinking water regularly? Could he be hypoglycemic? Has he eaten food like he's supposed to? Obviously, then any allergies or medications, allergies to anything. Obviously, we see that later on she says that he's allergic to wasps, but also does he take any kind of medication that would give us any kind of idea that he has any kind of a health ailment that could possibly be related to the fall. And then see what he's been doing most of the day. Has he been out all day working out in the sun, or has he been just out for a couple minutes, got stung, and fell over, maybe 10-15 minutes. So to kind of give an idea of, has he been going at it all week and he's continually deteriorated, or to where he got to the point that he passed out, or has he just started working and there's no reason to think that possibly it's heat exhaustion or stroke? We then talk about that there's no health problems, no medications other than he's had lunch about an hour ago and allergic to wasps. She can't really provide any more information. So we look at his vitals. His vitals are within a normalish range. Obviously he's tachycardic and he's tapneic. I never know if I'm saying that word right. He's breathing fast. And then his cap refill's bad, which means he's not getting good it's greater than 2 seconds, which means he's not getting the best perfusion. His oxygen's okay. It's 95. We'd really like it to be a little bit better, but it's not too low. And his blood sugar's good. So what treatment's indicated at this time? We'd want to start an IV in case we need to give it medications, and then possibly some fluids. Supportive care really at this point. We're going to be continuing to monitor him really closely. Possibly, depending upon how his oxygen trends and the quality and depth of his breaths, possibly using a BVM to help kind of push those breaths in a little bit deeper, so he's getting fuller breaths. And then we're going to want to do well, and that kind of brings us to the next thing, because he gets to the hospital. They give him the epi. They give him the Benadryl push. Is it a push? It just says that they administer it. It didn't even say what route they administer it. Obviously, the epi is intramuscular. The Benadryl might be intramuscular as well. Not 100% sure on that. But what are the lessons to be learned? And then they find the wasp sting on his left thigh once he comes to. The lesson to learn from this case is to do a very thorough secondary assessment, especially if you can't seem to figure it out. If there is no medical history, and we know that he hadn't been out there long enough, he does have a contusion or a bruise on the back of his head, which could have caused it, but the symptoms don't really say head trauma that much, and maybe I'm wrong with that. But just to keep looking, if you can't seem to figure out why they are doing what they're doing, continue to look. Go back through your ABCs. I mean, you guys tell us that all the time, to continue to reassess. Start from the beginning. If you can't figure it out, if you're lost, if you don't know what to do, or you can't seem to figure it out, and maybe you're not going to be able to figure it out, but this guy's obviously having some kind of issues with the rapid pulse, the poor perfusion. I mean, that doesn't happen just from being outside for a little while and falling. We don't really also know how far he fell. That was another thing that we wanted to figure out is he up on a second story of this house and he fell really far, or did he just fall, off a 12-foot ladder? And it doesn't necessarily make a huge amount of sense as to why he may have walked off of the, climbed down off the ladder and fell over and hit his head, and that's why we have the big wound. I mean, we don't honestly know, but just to keep looking, to continue to check all of the things that we're supposed to, do a quality secondary assessment, and look everywhere to make sure that you can identify what the problem is.